back to back. One day, one the next day. And unfortunately, they were in close quarters. The funerals lasted for a very long time. And we have very poor health matrix in southwest Georgia. It's some of the poorest health outcomes and accessibility to health care in the whole United States. So we've had a very high incidence there. But when you compare this disease process to what normally occurs, I've written the public health budget for the state of Georgia in the Senate for a number of years and been vice chairman of appropriations. And when you look at the age of the people that are dying, I think that's very important. And you look at when you go into the extended care facilities, the nursing homes, the assisted living facilities, you see a higher incidence of it. And that's exactly what happened in Albany too. It's happened in the rest of the state. But more particular, you have older people, the elderly, the medically fragile, the immunocompromised people that are much more susceptible. But I think it is, you go back to that fear factor, and I think they have politicized a pandemic, and it's actually made it worse. And that's a shame. That's a shame. I think the Democrats have really pushed that agenda, and someone needs to call them out. Someone needs to call them out.
Well, I am, because I've been saying here for a month that if you look at the University of Southern California USC study, you look at the Stanford study, you look at the New York study. Now we've got one that's going to come out the next couple of days from Emory right here in Atlanta. You look at the testing results and the number of people that have it. It's in the 17% range. So you start running those numbers. Like what Stanford says is the mortality rate of COVID-19 is between 1 out of 1,000 and 2 out of 1,000. The normal influenza is about 1 out of 1,000. So it. And then if you take out the elderly and you take out those with compromised health, the COVID-19 mortality rate, the death rate, is under the flu. And yet we have shut down the entire economy, and you got people running around here with masks in Atlanta and buttons that say "Stay inside, save lives." The whole thing is insane. The vaccine is President-elect Joe Biden. The day after he gets elected, then the Democrats will give an all clear, tell everybody get back to work, and everything is fine. They'll magically come up with some study that says it's gone away when Biden wins on 100 million mail-in ballots. State Senator Renee Unterman, she's running for Congress, 7th District in Georgia, likely to get to a runoff that's a Republican district, running for the seat of the retiring Congressman
Rob Woodall,
who was the chief of staff for the infamous Congressman
John Linder.
Who
and
was
before
for the
that was
fair
Newt
tax.
Gingrich.
And before that, it was Newt Gingrich.
Yes.
And I remember Lindemann, what was his name? Lindemann, the fair tax guy.
Linder.
I remember when he beat Bob Barr.
Exactly.
That's
that was a brutal contest.
That was a brutal.
But it's a very famous congressional district. I mean, when it goes back to Contract for America with Newt Gingrich.
That's right. And that was I remember being on the steps of the Capitol when he rolled that out, and I guess it was 94.
Yeah.
Yeah, it was 94.
I was there. Back. I was a county commissioner at that time for Gwinnett County.
See, and now you're running for Congress. So, Truth in Advertising, truth be told, the John Fredericks Show has enthusiastically endorsed Renee Unterman for her bid for Congress. She'd be a great congresswoman. She's a Trump supporter from the first day. She has his back. She's a fighter. She's going to go up there, drain the swamp. A lot of people get up there. They're first, no matter what they say, then they get there, then they go to the cocktail parties.
You got that. And I think Rick Jackson right here will attest that I will not shy away from a controversy at all.
That's not been your history.
No, it's not. And I look forward to being up there with Trump because he needs some good defenders. He's got some up there, but he needs more troops.
Plus, I need friends when I'm there. That's as I say, I told this one other person out back and running, my good friend Dr. Paul Brown, and I told his wife, I said, misery loves company.
Yes.
So I got to have something to do, and I'm up there all week. I'm also with Rick Jackson. He is the chairman and chief executive officer of Jackson Healthcare, one of the biggest hospital companies in the United States, and
actually, we staff hospitals. We
hospitals.
don't own a lot of hospitals.
But you're in the hospital business.
Yeah, that's right. We know it, though.
So you know everything that goes with it, Rick.
Yeah.
I want to get to Renee here and your race and some of the stuff that's going on. So we were talking before we went to the break, Renee, that I believe that a lot of these Democratic swing state governors, I live in Virginia, I've got one of them, they're going to keep businesses locked down, shut out, so they can continue to tank the economy.
Can you imagine if Stacey Abrams would have become the governor of the state of Georgia in the position we would be sitting in right now?
What would it be?
It would just be incredible. And the fact that she wants to go up there with Biden is even more incredible, because it's the bastion of liberalism. I mean, it is everything that Trump is fighting with socialism and AOC. And as a matter of fact, on the Democrat side of the 7th Congressional District, you know, we've got the emulation of some of the candidates that are running. You know, they want to go in and fall in line with the rest of the gang up there and help Nancy Pelosi. But Stacey Abrams, thank goodness, you know, she's never denied that she didn't win. And, you know, she served in the House of Representatives, and now she wants to be vice president.
What and has she yet to concede?
She has never conceded, and you would never know that she was a loser. And
she never conceded, and she got just so we can set the record straight, Rick. She got beat by 50,000 votes and couldn't get in the runoff. So you got the 50,000 she got beat by, and she didn't get in the runoff. And they make it seem like, you know, he beat her by, you know, 1,000 votes. He beat her by 50,000 votes.
That's exactly right. That's exactly right.
Just
but that is pretty typical.
And he
of
got over
creating,
50%.
That's typical of the Democrat Party, of creating an image and pushing that image and marching with it. And, you know, nobody ever looks back. And thank goodness, you know, the fake news media, they help it along. And that's one of our problems here in the state of Georgia, is the liberal media. And it is so difficult being a red state. But that's why we got to have the Trojans on the ground, people like you that started a movement to be behind us, because we have to fight that fake news.
Well,
why is it when Trump has a convention and he doesn't have the Stacey Abrams 4,000 or 5,000 people? He has 50, 60, 70,000 people, and people standing outside of a stadium wanting to listen from the outside.
Because they believe in the message and the movement.
Exactly.
That's the whole thing. And right now he's the leader, the messenger.
And, you know, in the state of Georgia, we're doing a very good job of energizing that movement again. Mm-hmm. And when you look at our state party, we are doing very good. We've got a long ways to go to November, but we're going to get re-energized just as the economy's getting re-energized, and we're going to win.
All right, let me ask you a policy question. Looks like we're going to get stimulus, the son of stimulus, daughter of stimulus, another, I guess, $3 trillion on top of the other. I lost the numbers, Rick. I don't know how much it is. We lost the numbers. And apparently it's going to be a combination of infrastructure that the president wants, bailing out states and local governments so that we can bail out 3 decades of poor management decisions for Maryland,
Can I tell
Illinois.
you my opinion about that? Because I have been the appropriator.
Are you in favor of that?
Well, I have very strong misgivings. And the reason I do is Georgia is rated. We have a AAA bond rating. We've been very prudent. We have a rainy day fund that we're going to have to live off now. And thank goodness we do have that rainy day fund. But here we are compared to the state of Illinois. And they have these state-run pension programs that they haven't funded. They don't have good bond ratings. So why should all the states be lumped in together? Why should we be penalized for other states? Why shouldn't we be given an extra, points for being good students and good, prudent students of the taxpayers' dollars? And I just don't favor handing out and doling out and putting our kids.
So as a state senator, part of the legislator, and Beth's going to be with us in a few moments. She's running for statewide office for a judge, nonpartisan, but she was part of the General Assembly. She was a Republican there. So you guys were great stewards of the money,
Right.
great stewards of the state, balanced your budget, didn't
Right.
get in debt, managed
So
your
why don't we
pensions.
get lumped in with
And now you
Illinois and
wanna
California?
you have to send your tax dollars to bail
Right.
out Illinois, Maryland, California, who have made
Yep.
terrible decisions for 30 years.
Exactly. It's like
How does that make
congressional.
sense?
It's like congressional balancing with transportation funds. We send all the money up there. We're a top tier state. We send all our federal tax dollars up there, and we don't get our money back. It goes to another state.
You're
It's
the
called-
donor state.
Yeah, we're a
Right,
donor
you're
state.
You're the donor state.
Exactly.
Thank you, by the way.
No, don't thank us.
Thank you for giving Washington, D.C. money.
But we
don't
should
deserve.
not. We should not be penalized, and we should not be thrown in with those other states that have not done their fiduciary responsibilities.
There's Renee Unterman, state senator, Republican, running for Congress 7th District. It took her about 10 minutes. We finally got her fired up now. She's pissed off because she doesn't want to send Georgia tax dollars to Maryland,
California.
Illinois, and California. Oh, by the way, where they're giving money to illegals. By the way,
Well, we have a lot of
And they
transplants
and they
from
lock the
California.
beach
There's
down.
a lot of
And
people moving, and it's so interesting when
they
they
lock
move
the
to the
beach
state
down.
of Georgia. Why do they move here? Because we have low taxes and a good economy, right?
all right. So I'm going to go to Rick. Going to go to Rick Jackson. So, Rick, how do we make hospitals great again? How do we open up hospitals? I mean, you got hospitals furloughing thousands of people. Some of the numbers you gave us earlier. How do we get hospitals back open?
Well, it's very easy from my standpoint. And look, I don't want to say that it was a total mistake because they had a supply problem, and because of COVID-19, the nurses started using everybody 10 times more PPE, and so they were making a run on it. But we've solved that problem now. So we could get this economy back. In fact, I think the GDP went down by 4 or 5% last quarter. Half of that, was healthcare.
No kidding.
I mean, we can turn you can't turn off the rest of the economy that fast. Healthcare could be running at 100% in 30 days, and here's all you got to do. Number one is you lift every restriction on any doctor or hospital from doing anything. They can do anything that they want. Get rid of that, because that's what that has happened. They've been told by governors, you can't do surgery, you can't do these things. So lift that, number one. Number two, you have to keep the supply of PPE and tests coming for the healthcare workers and people walking in the hospital. So you absolutely need it for that. And then just get out of the way, because doctors and nurses and hospitals, they've been fighting infections for 100 years. They know how to do that, and they know how to bifurcate and put people that do have COVID-19, quarantine them in a different area and protect them, but take care of all the other patients. Besides taking care of patients, you get the economy, you're 20% of the economy. And I actually think it's more than 20%, and I'll tell you why. So if you're paying 20% to nurses, doctors, hospitals, prescription people, and all that, those people go home and buy food, gas, houses, and so forth like that. So I think it's the number one economic driver of the United States. I really do. But we can turn that back on 2.5% GDP tomorrow morning just by lifting all restrictions and giving them the supplies they want, and let them decide how to take care of patients. They're not going to do anything dangerous. They'll figure it out.
So all you want is governors to lift all restrictions. No, as far as elective surgery, anything else, emergency rooms, just lift it all and say hospitals back open for business. Each hospital does whatever they want.
Absolutely. There's really no reason. I don't know what Renee.
And what you're saying
I think
is like
there's-
half the. Just excuse me a second. So you're saying half the GDP collapse that we've had has come from the healthcare system, and that's
Absolutely.
the one thing that you can get. Most of there's some of the demand, though, Rick, like you said, is not going to come back because people are afraid to go to the hospital because they don't want to get sick, right? Because of the fear factor. But you're saying the majority of it, people just they'll just go back to the way it was.
I think they will once.
I'm sorry.
And here, healthcare leads the way for all economies. So, as an example, I've had 2 appointments canceled by routine doctor visits I'm supposed to have. So, I'm psychologically saying, well, if my doctor doesn't feel like it's safe to go outside, why am I going to go to a restaurant or go to get a haircut or something like that? So,
Right.
so psychologically, so we
Right.
have to. So, once the doctors call me up, and say I can see you in May, which they have, thank God, then all of a sudden I have an event where I go and find out I don't get disease and they can take care of it. And so then I say, well, maybe I can go to the restaurant or something like that. But basically, this is the hike from center to get all of the economy off going again. And they can do it. There'll be some people that are fear, but once they are, if we could just get the media to go to Emory, for instance, it's opening up, right?
Yep.
To go to Emory and find out there's regular patients there, people are safe, they're not wearing these space suits and all this kind of stuff. Then we have those images, people will start. But when doctors call their patients and say, I'd like to go ahead and reschedule that appointment and so forth like that, then people will feel more comfortable then when they're not hearing people dying up in New York and all these kind of things. Those images are going to go away in 30 days.
I think there's two things that COVID-19 has taught us. Number one is telemedicine and telehealth, and teaching and educating the general public that it is efficient, it's more cost effective. When you got the sore throat, the earache, you can go on your computer. It doesn't cost as much. You go back to work, you get your prescription. Number two, the thing that was interesting to me, all of these governors across the United States, and exactly what Rick Jackson is talking about, the first thing they did in their executive powers in their emergency situations, they got rid of the regulations. That's the very first thing they did, whether it was federal or state. We got to work with the feds, but they got rid of their regulations. And here in the state of Georgia, it's called Certificate of Need. And we had a hospital called Piedmont Hospital here in the state of Georgia, and they were in the midst of this huge build-out, but they were waiting on their final Certificate of Need. Well, guess what? In the executive order, all of a sudden, that hospital could open right up within a week and put patients into the bed. So the question to legislators is, well, if it's good enough to do it now and we don't need those regulations, why isn't it good enough in the rest of the time?
So Senator Unterman, let me get this straight. So Certificate of Public Need, acronym everybody knows it that follows my show, COPN, right? So they had these regulations in place that were stopping expansion. So when the edicts came down, whether it be Georgia or other states, they just got rid of them. Said, hey,
exactly.
Because we need.
And it's the free
go
market.
Go ahead and build the hospital. We need the beds.
It's the free market and it's capitalism. And I have to tell you, and Rick Jackson will tell you, I have defended Certificate of Need because one of the issues is demand, and in the rural areas and access and keeping rural hospitals open. But let me tell you, I'm a believer now. Because when I saw the rest of the United States and all these governors doing the same thing, whether they were Democrat or Republican, there's no need for those regulatory processes. Let the free market reign. Let capitalism.
But when you took away COPN, as I recall, in Georgia, or relaxed it, you had I know at least one hospital in Southwest Georgia that went under immediately, in I think Augusta area. So, the argument with COPN is it's fine in the metro areas, but in the rural areas.
That's the question. That's the question. Because we've had an exacerbation of rural hospitals in the state close, especially in deep South Georgia. And I've actually been to every one of those hospitals, like Folkestone, Georgia, down on the Okefenokee Swamp. And those people are now going to Jacksonville and Brunswick and Savannah for services. And that is a particular need, but you can shape those laws and do metro-centric and let it affect the metro areas and protect those rural areas. It can be done, and this virus has taught us it can be done.
Rick?
Yeah, my problem, and regardless of the political statement, I'm just trying to state facts.
Right.
I have a problem when a governor tells a doctor what they can and cannot do. A governor, a non-physician. So in Michigan, when they said you cannot prescribe this hydroxychloroquine, mainly because the president said something about it, I think. But that's ridiculous because it was safe. So we did a survey. You'd enjoy this. About 2 weeks ago. And when you want to find out what a doctor believes about you or a family member, you ask this, she knows what the question is. What would you do with your family? We asked doctors, would you give chloroquine to your family? 65% said yes. And only 10% said no. And 50% said they would give it early, as soon as they were exposed. So my point is, and then we get accused of the, science issue. Well, somebody asked me about that, and I said, well, 1,800 doctors are scientists, and they have as much training as any of the people you're listening on TV. And if they would give it to their family, they've done some homework. They figured out the safety part of it, and whether or not it will work or not, it's kind of like, what do you have to lose kind of thing. But my point is, I had a serious problem when a governor says that a doctor can't prescribe something. That is never should happen. And that's what we're doing right now in this temporary situation. And I'm just saying there should not be any restrictions on a doctor making any decision about anything they want to do within the realms of their peer group, in accordance to their practices.
Senator Unterman, were you surprised at the quickness and lack of a resistance to people giving up their civil rights here so easily? Did that surprise you at all with these lockdowns? If you look at Michigan and Maryland, and people can't go out, can't see your neighbor, can only walk your dog twice.
No, I think they were willing to give it up because of that fear factor, and it was because of the media.
Yeah.
And the media perpetuated that fear factor, and they were willing. But I think they awakened, and they awakened very quickly. I know here in the state of Georgia, we had a grassroots organization that mobilized, and that's a good thing, because that is a serious consequence. No matter why, I've been a big defender of gun rights. My whole political career, I have an A rating. And that's one of the biggest fears of the government taking away your guns. And it's a very real fear, because I heard some governors on television talking about, the need for social obedience. And one of that is taking away those guns. And
so we went from social distancing, Rick, to social obedience.
That's exactly right.
And of course, the next step to social obedience is just what you say.
Exactly.
Eliminating the Second
Well,
Amendment.
that's how you get to
and taking your guns away.
socialism. That's how you get to socialism and liberalism. And if you look at the indoctrination of young children and college kids and their acceptance of that socialism theory, that's how you jump over. That's how you get into that ideology, and that's how government changes.
Renee Unterman, running for Congress 7th District, your primary June 9th.
That's right.
People want more information. First of all, we're an enthusiast. So everybody knows I'm an enthusiastic supporter of Renee Unterman. We need to get her to Washington, so I have a friend there that I can talk to. Misery. I love this line.
I got a feeling you got a whole lot more friends up there.
Misery loves company.
I got a feeling you got some more. And if I get up there, I'll bring you some more friends.
You're going to let me do my show in your office, right?
Yes.
Website.
ReneeUnterman.org. I'd love to have everyone on the team. I ask for your vote. I ask for your support, and I certainly appreciate yours. I appreciate your friendship over all these years, and I also appreciate what you stand for. It takes an army to do what we're doing, and we got a great one moving forward.
Renee Unterman, thank you for joining us today live in the John Fredericks Show in Atlanta. You've been a very long friend. Everybody knows I'm very loyal to my friends, but I love Renee. She's going to be such a great Congresswoman. I can't wait till she gets there, and I can do my show in her office along with some of my other friends. I also want to thank Rick Jackson for being with us, Chairman and Chief Executive Officer of Jackson Healthcare, and sharing us that. Rick, I'm going to have you back on occasion so we can, because you're like Mr. Factoid, right? You got all the facts here, and the numbers of what the media is telling us just don't add up with all those facts that you have, Rick.
Yeah. Well, thank you for having me on. I'm obviously very passionate, been in healthcare for 40 years, and it just bothers me every time I see the news and all these, and everybody thinks the hospital is full. And in the meanwhile, some of our divisions are losing 50% of revenue because of it, and it's totally unnecessary. And that's why I was passionate about it, and I've been tracking it nationally. So if we can get health care turned on, and Governor Kemp already basically said you guys can go back to work, and thank you for sitting to the side while we try to solve this problem. So we're glad about that.
What leadership he's shown, Renee?
Well, it's a different
impressive.
time. It's a different
what
time.
leadership he's shown.
It's a different time.
And then there's no bigger Trump supporter than me, but I've been very critical of the clown show going on in the White House right now. I think their communications department has been an unmitigated disaster. I told them they need to bring Corey Lewandowski in there because it just can't go on. But he even stood up to he even stood up to Trump when the president said, I think this is a bad idea, and threw him under the bus. And Bryant said, well, thanks, sir, but I'm going to open my state for business. I think deep down, Trump was like, I like that. That's why I like that guy. So, but look, it takes one. And Kemp did it. Now Tate Reeves has done it in Mississippi. That's why I'm going there. So you can always count on my show to go where the action is and back those people that have the courage, because we got to break through the fake news, right?
That's
We're out of
exactly right.
time. Go to reneeunterman.org. reneeunterman.org. I want to thank Rick Jackson for being with us. Rick, thank you.
Thank you.
Excellent.